Hello again, I'm Dr. J.C. Smith here in wonderful Warner Robins. Today I want to talk about an exciting new documentary that's come out. You may have seen it advertised on the Peacock channel. It's about Dr. Death. This is a neurosurgeon in Dallas, Texas, who's now spending his life in prison after killing 2 people and maiming 33. It's a fascinating 8-part series I encourage you all to watch, because for the first time someone has made a movie about the downside of back surgeries. It is more corrupt than anybody understands except for chiropractors, because we see these surgical failures and it's more than you can ever imagine. Actually, Modern Healthcare is a very reputable medical magazine, and they did a study that showed that, first of all, the cost for back surgery in 1 year is $96 billion. They also mentioned how there's a 50% failure rate. They also mentioned that only a third are at all successful, a third no effect, and a third get worse. Meanwhile, what they didn't mention was that these surgeries are based on a debunked bad disc theory. So today I want to talk about all these things, because this is an issue that everybody's going to face. 80 to 90% of Americans have bad backs, bad necks, and when you go the medical route, they're going to railroad you into drug shots and surgeries. That's what I talk about in my second book here, about the media war against chiropractors. It's just a foregone conclusion that you're not going to be told the truth about what is the cause of your back pain. You don't slip discs, you slip joints. Then secondarily, once the mechanics of your spine are altered, then the disc flares up. A disc is simply a sponge. It's not a muscle, it's not dense fiber. There's just mostly moisture, water in there that separates this from the vertebra from each other. So a disc is totally secondary. But anyway, getting back to Dr. Death, he was in Dallas about 10 years ago. I remember reading about him back then, because on my other website, chiropractorsforfairjournalism.com, I wrote articles about this guy. And here's what Time magazine just described about this new documentary about Dr. Death. He says, quote, "The nightmare at the center of Dr. Death, a new Peacock drama, involves a surgeon who seems intent on using his scalpel to destroy the lives of his patients, and a medical system content to let him skate by." And that's the thing. It's one thing to have a surgeon who makes a mistake, because I'm sure they all do to some degree. But this guy seemed more intent about doing it. But the crux of this drama is not just showing him and how he would get drunk and stoned on coke and hang out in strip bars. He was a despicable person. But how when the good doctors in this storyline, played by Alec Baldwin and Christian Slater, these were 2 good men, neurosurgeons, who knew he was a rat, and they were trying to get him kicked out, trying to stop this guy. But whenever they went to the authorities, they hit a dead end. I find the same thing here in this town. I've made gestures along the same line, and people just turned a blind eye and deaf ear. First, they went to the hospital administrator. She didn't want to hear about it, because the average neurosurgeon brings in over $3 to $4 million a year. In fact, the Dallas hospital where he worked at Baylor University there, they were paying Dr. Death, his real name is Christopher Dunch, $50,000 a month just to do surgeries in their hospital. That's how profitable these things are. And they pay, most all surgeons are getting paid off by hospitals. And that's another reason why chiropractors are not in hospitals. Legally, we're allowed to be there, but we can't get by the hospital privileges committee. I don't know why one group of MDs can stop another practitioner license from working in a public hospital. That's unconscionable, and that's what the Wilt trial antitrust law is about. And the judge ruled that they cannot do that, but they still do it. Anyway, this is how this leads to this, is that when they went to the hospital administrator, she said, "I'm not kicking him out. He makes too much money." So then they went to the Texas Medical Board, and again, they said they're not going to handle it. They don't want to get sued. Plus, there's also one thing you'll discover. There's what is a medical white coat of silence, which is like the police blue coat of silence, where they will not testify against each other. That's why if you have a legitimate case, you're going to find the same thing. It's next to impossible to find someone who will testify against the doctor that hurt you. So then they went to the district attorney, but he was running for re-election, and he was fearful of making an issue about this for fear of losing medical donations and contributions to his campaign. So again, he turned him down. And then the cases kept piling up, so finally these two good surgeons went back to him, twisted his arm, and just to get them off his back, you might say, he appointed the youngest female attorney in his crew there to work the case, thinking that it was too much for her, she'd blow it, it would go away. Well, he was wrong. She was a bulldog. She pursued this and won the damn case. Another problem I'm finding is the AMA is the biggest political lobby in this country. On the national level, state level, local levels, these guys have a lot of money and they influence a lot of politicians. For example, I have a case against the Air Force Base because TRICARE covers chiropractic, but this base refuses to cover it. They lie to people saying it doesn't, even though the 3 Army posts in Georgia have chiropractors on staff. This base at Robbins is telling people that it's not covered at all. That's a big fat lie, and I prove it. I wrote an article about it. And I went to my local representative, U.S. Representative Austin Scott. And when I went to his office, he was the most inhospitable person I've ever met. And finally said, "You didn't do your homework on me, did you?" I said, "What do I need to know about you?" He says, "My daddy's an orthopedic surgeon." Well, right there's his bias, right? So he said, "I ain't gonna investigate the base for you." I mean, he's a real redneck kind of guy. So anyway, these are all the obstacles. People turning blind eyes, they're resistive, they're negative. They're not gonna help you. That's why this case in Dallas was so remarkable. It came down to this lady DA, assistant DA. She won that damn case. But this is not just isolated to that one doctor, that one surgeon. They're all the same way. And let me explain why. What I would have liked to have seen, this is a sign of a systemic failure. It's not just this one bad neurosurgeon making mistakes and a system that enabled him, because they're all making too much money. Right now, the back pain industry is the most profitable of all in all of medicine. Each year, $134 billion is spent on neck and low back surgeries. And it's more than cancer, heart disease, diabetes. It's the #1 moneymaker. So that's why one reason why they don't want chiropractors on hospital staff, because we could get 90% of those people out of there at a fraction of the cost. And they know it. The research is all there. If you want to learn more about that, read my books. You'll be happy to learn that information. But this is all being suppressed. They don't want you to know there's a better mousetrap. There's an old saying about Occam's razor, where the more simple solution is usually better. Well, that's exactly what's happening in spine care. The reason for it is most spinal problems, 50 to 75, 80%, are joint problems. Again, you don't slip discs, you slip these joints. That's why manipulation that we chiropractors do, or traction, decompression, yoga, tai chi, massage, anything that moves joints, people feel better. It's when the joints get twisted and compressed, then you're going to have a back attack, and secondarily the disc bulges. So if you want to get well, go to a chiropractor. Let them decompress your spine, adjust your joints, go to a massage therapist, and you will feel better in 90% of the cases. There's always that 10% that need the heavy-duty drug shots and surgeries, but most people don't. But anyway, back to Dr. Death. Although the producers did a great job, what they didn't do was like a pre-story or the backstory of this whole mess. In other words, when you go into a doctor's office or the hospital, after the diagnosis, legally they're supposed to tell you, give you it's the doctrine of informed consent, where you're told not only what they're going to do and the risks and all outcomes, but they're supposed to tell you practical alternatives. That's the law that no one around here does. I do informed consent on every patient. And they all look at me saying, "No one's ever told me that before." They don't. If you were brave enough to ask, "Should I go see a chiropractor before doing your risky surgery?" If you're brave enough, expect to get the wrath of the surgeon. I've heard this a million times. If you're stupid enough to go to a chiropractor, don't come crawling back to me when you're paralyzed. Honest to God, they still tell those people that. What's interesting is that there's been research on who's hurting who. And that's what this is about. We'll put this on for you to see, but it's back pain treatments. This was done by the Gallup Poll and Palmer College. And you can see the first 4 columns here are medical: low back surgery, neck surgery, over-the-counter pills, and opioids. And 2,500 people per 1 million using these medical techniques are either killed or seriously affected, like paralysis. Over here in the last column is the chiropractic damage, and it's 1 in 5.85 million. So who's hurting who? Another thing you can go by is malpractice insurance. A neurosurgeon, a back surgeon, depending on how many they do, will pay anywhere from $200,000 to $300,000 a year, because one oops moment is a $300,000 settlement on the average. My neighbor just retired as an OBGYN here in town. He retired when his malpractice got to $5,000 a month, $60,000 a year. Well, you know what I paid last year? For the last 40 years? $1,500 a year is what I paid. So who's hurting who? But nonetheless, these surgeons will look you straight in the eye and lie to you. And then they'll tell you, you got a bad disc, you need surgery. Well, that's also been disproven. It first started in 1990. Dr. Scott Bowden, who's a very famous spine researcher, instructor, and he actually now runs the Emory Spine Center up here in Atlanta. But his claim to fame 30 years ago in 1990 was when he did MRIs on people with and without back pain. But both groups had bad discs of different sorts. Yet this group had no pain. So that was in 1990. Since then, there's been 33 other studies done. So in 2014, the Mayo Clinic put together all those studies that came up with a consensus. And we'll put this on the screen for you. This is fascinating. Now, these are asymptomatic patients. No pain, no problem. Yet they found by the time you're 50 years old, there's an 80% chance you're going to have disc degeneration, if you can see it there. 80% chance you're going to have DDD, degenerative disc disorder, but you have no pain. Again, most pain is generated from the joints. You can see for other bad disc problems, loss of disc height, disc bulge, also 73, 56, 60%. You see the high prevalence. So it's very easy for any doctor to find a bad disc of some sort in most adult spines. But again, these are asymptomatic. Again, most back pain is due to the joint dysfunction. That's why adjustments get the joint motion restored. And then non-surgical spinal decompression, like the DRX 9000, by decompressing the disc, it actually can rehabilitate it, suck nourishment back into the disc, increase the height, and also rehabilitate the disc. I get on it myself every day. But nonetheless, this is kind of the big lies, the big secrets that AMA is doing. They're not telling people the truth about the latest research. They're just saying, oh, you got a bad disc, automatically needs surgery. That is just not true. Another problem we're finding is that most primary care doctors are not trained in musculoskeletal problems. They have less than 10 hours of training, and that they do the same knee-jerk reaction. You got a bad back, drugs, shots, and surgery. We know that doesn't work. It was these promiscuous prescribers that caused the opioid epidemic. When they finally did research on why are people taking opioids, which is a medicinal heroin product, you may not know that. That's why people get addicted, because it's heroin they're giving you. But most people taking opioids for back pain, 30% for low back, and then if you combine neck and other musculoskeletal disorders that we chiropractors can adjust, it adds up to 70%. Now there are the 10% of people who need it legitimately, post-surgical, cancer, terminally ill, people like that. But that's less than 10%. Most people are taking it for back pain, musculoskeletal disorders, where the joints are jammed or twisted, which is what we help. So anyway, instead of sending them to us for a non-drug solution, they send them off on that road down that heroin, and that leads to these addictions. It was interesting for a few years back, before the VA would send their injured warriors in here for a non-drug solution, they made them do the heroin pills, opioids, and have steroid injections, which do nothing to control the pain. And actually what they found is the steroids will demineralize the vertebra and dehydrate the disc. So they actually accelerate the degenerative process. But I tease these men and women who come to see me, these VA patients, I said, you know, if you were doing steroids and taking heroin and you're in the Olympics, they'd kick you out, or in the NFL, because those drugs aren't, you know, they're not helpful, they're hurtful. But that's what they did. That's how convoluted the medical system is. It's just upside down and backwards. Nonetheless, another reason why people are getting railroaded into surgeries that they didn't mention on the movie was because of lack of hospital privileges. This was the focal point of the Wilk versus AMA antitrust trial that was settled in 1987. And the judge ruled you can't keep a chiropractor out of a hospital just because he's a chiropractor. Well, before the ink had even dried on the judge's order, the AMA's attorney, Kurt Johnson, had already issued a press release saying, this decision changes nothing. And sure enough, it did. There's just as few chiropractors today on staff at hospital privileges than ever before. So when you go in, you don't even have the option to get chiropractic analysis, diagnosis, or treatment. They just railroad you onto that medical railroad to drug shots and surgeries. Another thing that the medical doctors are not doing, they're not following the evidence-based guidelines. Since this became pandemic back pain, every country, every governmental agency has come up with guidelines. And in every situation, they say the same thing. Try conservative care first. Conservative means non-drug, non-surgical. It doesn't mean right-wing politics. Before you do the drug shots and surgeries. Right now, surgeries are the last thing you want to do, because again, they don't work. They don't stabilize your spine. They're dealing with a secondary problem. And like I say, they're built on a false premise. The bad disc theory has been totally debunked. And everybody knows it except those people profiting, which are the damn surgeons. And so anyway, and the thing is, these surgeons, they know this. They know the research. Yet they're willing to look you in the eye and keep this as a secret and lie to you about, oh yeah, you need surgery. So people have the surgeries. We all know people who've had failed back surgery, don't we? And not just one, because they always say, oh, it didn't take. That's the term they use, didn't take. Let's do another and another. And so I have patients who've had 2, 3, and 4 back surgeries. And we still adjust them. And you know what? Most all of them feel better to some degree. Because once you get these joints moving in the right direction, you decompress the spine, and then start stabilizing the core muscles, people feel better. So again, there's a backstory to this surgical mess that they didn't really tell you about. And I didn't expect them to do it, but that's what I write about and my books and all. So anyway, don't think that this Dr. Death is the only one doing this, because right here in our town, we have Knife Happy spine surgeon, and they're making a ton of money. The Macon, Warner Robins area per capita is the back surgery capital of Georgia. The Bay sends everyone in for back surgeries. Workman's Comp. I've been here 40 years. Federal Workman's Comp covers chiropractic technically. I've never had a referral. And one year I did a Freedom of Information Act, and they found that year, I think it was 2012, there were 2,512 neck and back related injuries on base, which is the largest single site employer in the state of Georgia is Robins Air Force Base. 20,000 employees don't get referrals, even though back injuries is the #1 disabling condition in the workplace. That's been well proven. And when I got that FOIA back, like I say 2,512, not one was sent to a chiropractor. And when I inquired, they said, well, we didn't find a subluxation, which is a biomechanical misalignment that we detect only, and that's what we correct. And that's what most back pain is a biomechanical, like say, where the mechanics of the spine are altered. And I said, well, how can you not? And well, it turns out MDs are doing the diagnosis. MDs aren't trained in chiropractic science. I mean, I could point it out to them, they wouldn't know what the hell they're looking at. This is how upside down it is again. They've got ignorant MDs misinterpreting x-rays and then send them down that drug shots and surgery route. They don't get better than people come to see me, and I'll analyze their spine and show them where their misalignments are, and they're pretty easy to detect. You don't have to be a rocket scientist. And people, why didn't they show me that? I said, yeah, good question. Because they're doing a patho-anatomy thing. They want to find bone spurs, arthritis, bad disc. And everybody's got that, just like this Mayo Clinic study found. What they're not doing is what's called a pathophysiological analysis. How does the spine function? Because your spine's a weight-bearing column, 24 bones, and they all move and twist and bend as you do your daily activities, right? So that's what we focus in on, to restore the pathophysiological aspect of your spine. And that gets back to the 4 principles I teach in my office. If you want to have a healthy spine to stabilize, you have to restore the alignment as best possible, improve the core strength, induce flexibility, because again, there's 137 major joints in your spine, 364 altogether when you count up the rib heads, a lot of joints. And then you have to decompress it. Because again, your spine's a weight-bearing column. All day long it's sitting compressed. So it's nice to decompress it once in a while. That's what our tables here do, and exercise that I get people also do. So until you restore the integrity of the spine, you're going to have all these bad discs. You're going to have a bad back, and some doctors say, oh, you got another bad disc, you need surgery. And we know where that goes. And those people never get better. But even locally here, we've got some surgeons that are out of control. We've got a few doctor deaths around here. One guy in particular, I heard he's now been suspended. But nonetheless, within a month, I had 2 of his victims come to see me. Here's one of them. This is an old patient of mine when he was active duty. As long as I adjusted his neck, he was fine. He went off to college. 20 years later, came back to work as a civilian. And he had a stiff neck. But TRICARE, because he's an old VA guy, they sent him in to the surgeon, who said, you got a bad disc, you need surgery. And he goes, should I see my chiropractor first? He says, no. He gave him the voodoo. If you're stupid enough to go to chiropractor, don't come crawling back to me when you're paralyzed. That's what I call the voodoo diagnosis. Totally unethical. So anyway, this is what he did to him. This is shocking. He fused his whole neck. You can see the screws and the rods. The whole damn neck. Huh? This guy had no cancer, no fractures, no infections, no red flags, as they're called. He just had a stiff neck. And that's when the top 2 vertebrae, the atlas axis, get locked up. Easy adjustment. Quick and easy and effective. And you know what he charged this patient? $250,000. Yes. Now you see why they love doing them, why hospitals love hosting them, why everybody's enabling these knife-happy surgeons to do their thing. They're making a ton of money. Spine surgeons have one of the highest incomes of all medical specialties. They're like in the 800,000 range. And then they get kickbacks from MRI centers, hospitals, drugs, device manufacturers, you name it. They all kick back to these guys. I read one article that says they can double their salaries just by all the kickbacks they get. These guys are out of control. Their surgeons gone wild, just like this Dr. Death. There's a lot of them out there, unfortunately. I mean, there are times you need surgery, like I said, the red flags, cancer, fractures, infections. But most people don't have that stuff. They just have spinal misalignment. So it's a real problem that is going to continue. And I say I hope this Dr. Death movie gets a lot of traction. Because like I say, I've tried to make people aware of this for years with my books. I actually had an interesting story about Dr. Sanjay Gupta at CNN. Nice guy, I enjoy watching his shows. But when my first book came out, I had a book publicist and who used to work at CNN. And he told me he knows all those guys. He says, I'll take your book there, Sanjay Gupta, have him interview you. I said, great, spread the word. Then he came back and he said, what did you say to Dr. Gupta? He said, you've been banned at CNN. I made that a whole chapter in this book, how I got banned at CNN. Well, what it was, back in, when was it, 2003 or something, Dr. Gupta did an article about how chiropractors are causing all these strokes. At that time, I'd never heard that claim. I actually phoned up my malpractice insurance company and said, is this true? And she said, we don't know, we never had a claim for it. Well, as I said, the likelihood of that is 1 in 6 million, according to this study. But the likelihood of medical mistakes, spinal care, is 2,500 per 1 million. So I wrote an email to Dr. saying, can you prove what you said is true? Because I've never heard of that. Well, I didn't get back. Anyway, then Dr. Bowden, as I mentioned him before, he was the first orthopedic surgeon researcher who did MRIs and found bad discs and pain-free people. And thing is, Dr. Bowden works in the same Emory University department as Dr. Gupta, who's a neurosurgeon. The other guy, Bowden's an orthopedic surgeon, but they work elbow to elbow. They know each other. They're both famous, right? And I said, in another email, I said, why haven't you told the public that just because you have a bad disc, like Dr. Bowden showed, doesn't mean you need surgery? And I said, since you work right there with him, shouldn't you inform your viewing audience? Because this is the biggest misdiagnosis in all of medicine. you got a bad disc, that automatically means you need surgery. Big fat lie. And he never did that segment, right? You've never seen it, I never have. So when my book publicist went and tried to get this book on the show until I was banned, and I said, well, what did I do? And he said, well, I confronted him about not sharing this news with his viewing audience. So what do you call that? When Dr. Gupta knows, he knows better, but he's withholding this from you, the viewers. Because how popular would he be when he went to the next spine surgeon convention after telling the public all these bad discs these surgeons are cutting on, maybe unnecessary? He wouldn't be very popular, would he? So that's a big cover-up. It's a big cover-up. And who suffers? People like the 33 that were maimed and the 2 that were killed by Dr. Death. And it's a systemic-wide failure of the whole medical spine system. It's really sad, and it's a big cover-up. The hospitals, administrators, insurance people, they're all covering this up. So buyer beware. And if you're having a back attack, I don't care what your diagnosis is, go to a local chiropractor in your neighborhood. Come see me. But nonetheless, get a second opinion from a true spinal doctor. That's all we do the spine. We don't fool around in other things. We do the spine. Actually, we should be called the primary spine care provider, because that's all we do and we're best trained at it. So get a second opinion from a good chiropractor before you jump into some doctor's idea. Just do the surgery. Nope, you'll be sad you did. So otherwise, I want to thank you for listening. If you have any questions, feel free to contact me. Otherwise, I'll see you next time.